John Seffrin with the American Cancer Society, can you give us a sense for how insurance is going to change? What are some of the differences in the rules in this law? We're talking about changes with pre-existing conditions. What does this mean for the country's sickest patients and for all patients? What does this mean?
Well, I think it's transformative. I think the choice of the word transformation for this conference is highly appropriate. And this is true for all patients, but particularly, I would suggest, cancer patients. It means that for the first time in the history of the Republic, people will have access to survivorship. My organization is the largest voluntary health organization in the world. We have 3 million volunteers and $1 billion in revenue. When we got started 100 years ago, there were virtually no cancer survivors. Today in America, 2 out of 3 cancer patients are survivors. The key point, the third loses his or her life most often because of lack to access to health care through insurance. So when the American Cancer Society started 25 years ago, the National Cancer Database with the American College of Surgeons, we have the only database in the country that could show during the debate on the Affordable Care Act the following. It has stage of diagnosis, outcome, and whether you have insurance or not. And so we were able to show the American public that a woman with stage 2 colon cancer with insurance had better 5-year survival rate than a woman with stage 1 colon cancer who got treated. Very important point. It's no surprise to anybody that if you don't have insurance, you're likely to present with a later stage disease. It's a total surprise to see that even if you get diagnosed at stage 1 where no one should die, you're more apt to die because you don't have insurance. So it would be difficult for me to exaggerate how important the Affordable Care Act is, because for the first time in history, all of our citizens will have access, in the case of cancer, access to survivorship.
So, John, for patients, for cancer patients, or really for any patients, what are the most important insurance changes in the law?
I think for cancer patients in particular, think about it for just a minute. My wife is a breast cancer survivor, couldn't get health insurance. Now, anybody who needs health insurance can get it. There are no annual or lifetime caps. If you have a serious cancer, children can sometimes exceed a lifetime cap in 1 year of treatment. And then I think what's really important to remind everybody, and that is, however we build this out, the centerpiece is going to be access to preventive services. And we now know that over half of all human cancer is preventable during a normal human lifespan. So if people now have access to colonoscopy at age 50 when they need it, or some other kind of test, we can actually prevent a colon cancer from occurring or prevent a colon cancer death from occurring. So this is huge and transformative for all patients, but especially cancer patients.